title was wrong, but the write-up was correct, and that this is on grief and addictions. And I've worked in the area of trauma, grief, and loss for 28 years now. I remember early 80s, I was asked to do a half day at a provincial drug and alcohol government workshop. There was one speaker in the afternoon, and I was in the morning. And when I arrived, I started in the lobby of the hotel hearing some grumbling. Don't we have enough to deal with without having to add grief and loss to it? Like, geez, addiction is hard enough without bringing something else in. And I heard this over and over again. And it was, so I started, and asked them what losses they experienced in working in addictions. And for, probably a minute, people were shrugging, and then slowly it started coming. And of course, losses in themselves, in their desires for healing for the people they're working with, when that doesn't come to pass. The losses that they realize that so many addicts often started that addictive behavior after an unresolved loss. Or the losses that are brought about by the addiction itself. And I had to finally stop them, because I said, hey, we've got to get on to other issues here and other strategies. But of course, now I don't have to do that, because you all know that there's so much loss. My definition of loss is any experience that restricts us. And that can be as concrete as a death, as a chronic illness, and it can be as nebulous as the shattering of a dream or expectation. And just because it's nebulous doesn't mean it will be grieved easier or it won't take as long. It might be even more difficult, because it's often some of the nebulous losses that are disenfranchised by our society. We say, you shouldn't be grieving for that. Like, just grieving for your friend alcohol or drug is not okay. And yet, I find in the work I do with people, if it's not honored, that yes, it was a coping mechanism that was very hurtful, and yet it was a big part of my life, and we're not grieving that consciously, it's very hard to disengage completely and move on. So I don't work in a addiction treatment program. I work in private practice, and I teach at universities and seminaries. But I find that many people come to me with trauma, with loss in their lives, and after they start to feel some healing, they are then able to admit for the first time they have an addiction. And I then can refer on, I can work with them in conjunction with other programs. But I find often it's when people do get a sense of hope for the first time, or feel that they have some resources, or they could work through to some extent, that they're then willing to admit something which has been blatant in their lives for years, but they wouldn't talk about. So in the short time we have, I'd like to present some of my models for working with grief, and hope that they'll be useful for you in your work, and some of the concepts and issues. I'm sure you know a lot about the grieving process, but I want to talk about some of the models that I use. And I want to start with a short exercise. So I invite you to close your eyes or to look down. I'm just going to ask you to think about something, and then to write a word or a couple of words on that little piece of paper that you all have. Anybody not have a little piece of paper? Because every table hopefully does. Okay. Thank you. Okay, if you could close your eyes, turn inward, and I'd like you to bring your attention to distress, to a pain, to a grief that you are carrying right now around addiction. Maybe it's a client you're working with who is having great difficulty. Maybe it's someone in your personal life. Maybe it's an unresolved experience of loss in your own life around addiction. But something that is distressing to you, is painful. And I'd like you to just focus on it and get a sense where that is in your body. On a scale of 1 to 10, with 10 being the most severe, how would you rate it as giving you distress right at this moment? And now I'd like you to shift your focus and think of a symbol of support, of comfort, or of guidance. It may be part of your faith tradition. It may be, as we know, a symbol can be a person, it can be an object, color, word, or phrase. It can be anything, but something that is now in your life or has in your life given you support and comfort and guidance. I'd like you to just open to that, and when you are aware of it, just write it down on the piece of paper and then put it folded in the center of the table, and no one is going to look at it. And after you've done that, just sit back with your eyes closed or looking down and revisit that distress, that pain. Put your awareness back on it. Just see if there's any change. And what would you rate it at now out of 10? Then let that image go and open your eyes slowly. Thank you. Did anybody find a change occurred the second time? Neil? Went from a 4 to a 1. Okay. Quite dramatic change. Thank you. Anybody else?
I felt much change, and I found that I was resistant to get back to it.
You didn't want to look at it again.
Yes.
Yeah.
Exactly. So it was really mild, and I didn't want to go any further.
Uh-huh.
I sensed it down there.
Yeah, okay. But it was mild when you went back to it? Okay. Okay, anybody else? Yep. It what? You moved deeper into it? No? Yes? Uh-huh. Oh, your level of anxiety was lower. Okay, thank you. Okay. Did anybody find that it went the other way? Because some people say to me, what I realized is once I've opened to my symbol of comfort, it gives me the courage to deal with it. I've been avoiding it. I have not wanted to go to it. And so it actually is more in my face, and yet now I think I can do something. Some of you may have found nothing happened, and it doesn't with everybody. But I just want to say I work a lot with symbols because symbols are so powerful. You know, if we see a heart-shaped box and it's beginning of February, we're probably going to think love. And yet, if our best friend is waiting for open heart surgery and we don't think she's going to make it, we see that box and we don't think love. You know, and our anxiety is high. And so I know that with the strategies I have, if somebody has a symbol for their addiction, for their loss, for themselves, that is really dysfunctional, that is really restrictive, then I can't do anything to help them shift while they're holding that. Because that's their truth, and they won't let it go. And so what I try to do, rather than ripping that one away, is help them find other symbols that are healthier, other symbols that are more empowering. And I really trust that as they live into those new symbols, then when a choice point comes and they're thinking, you know, what do I do to protect myself or give myself comfort? that they will start to use the healthy one. Because it is freeing, it is empowering. So I find I work a lot with symbols, and as a therapist for myself, I want to make sure that I have symbols that are living for me, that are working for me. And ones that have worked in the past may not be still alive. And yet, out of habit, I keep them going. So symbols, same thing with affirmations. I try to help people find affirmations that are true for them. But I never give an affirmation, because if I myself come to, when one door closes, another opens, and that has deep meaning for me, and it is freeing and empowering, that's great. But if then I take my beautiful symbol and I say, David, I want to give you a present. When one door closes, another opens, well, I better jump back fast because he can punch me out. It twists and turns and becomes a rationalization, a minimizer, if it's given to someone else. So I invite people to look for, to find affirmations that would be supportive for them. I'm really clear with people that I'm not in the cure business. I want to be one of their healing resources. And I look to see the healing that is already taking place in their lives, that has already taken place, and what qualities that they have within them that they can use for healing, and I try to support that a lot. I told this story in the 3-hour workshop I gave, and people said, oh, well, can you tell it again today? So I did a lot of work with bereaved parents early on in my career. And I'd been told about this young couple, Bonnie and Chris, who had a baby die of sudden infant death syndrome, SIDS. And was told that their marriage was on the rocks. They were not talking to each other. They were full of guilt. He was starting to drink real heavily. And yet they wouldn't see me. I was at that point working for the Queen Alexandra Hospital for Children, and I could see them for free under that program. But nope, they didn't want to. But just over a month after the baby's death, I got a phone call from Bonnie. And when I told her I was really glad she'd called and would she like an appointment, she says, well, no, I'm fine, and Chris is fine. I said, okay, well, what can I do for you? She said, well, we're really worried about our dog, Lucky. I said, you're worried about your dog? She said, well, yeah, Lucky loved the baby and slept by his crib. And, well, her grief has got so bad that she's not eating, she's getting real skinny, and she's shedding hair, and she's peeing all over the house. So do you know anybody who works with dogs? So I thought fast and said, well, yes, actually, I could work with dogs. Intent is very important, right? So she said, fine, can we make an appointment? I said, well, I could see you tomorrow afternoon. But the thing is, dogs are pack animals, and to do individual grief therapy with a dog doesn't really work. You need to see them with their pack. Long pause. Then she said, that would be Chris and I, and we don't want to come for counseling. Now, obviously really unethical to try to trick him into therapy. In that few seconds of, oh my God, what do I do? What came was, I bet the dog is not grieving the baby after a month. The dog is grieving the estrangement in her people. And if I took her out of that dysfunctional family and did whatever I was going to do and got her back in again, her symptoms would return. So I hope that with them being present, that they could get on track with how to help their dog. And maybe get something for themselves. So I said, look, I promise I won't ask you anything about your own pain, about the baby. I'll only talk to you about your dog. So she made me swear, which I did. And then I also suggested that I go to their house, that Lucky's probably more comfortable in her own surroundings, which is true, but also I didn't want an incontinent dog in my office. So the next day, I walk up the stairs. Lucky hears me, starts barking. I shake Chris's hand, and I look at this very skinny, woe-begone-looking dog, who, as we go into the living room, flops down in the middle of the room. Chris sits here on the sofa, and Bonnie comes in from the kitchen with a chair, turns it around, and sits as far as she can get from Chris. They're both looking at their dog with anxiety, but they're not looking at each other at all. So my way of working is, where the energy is, what's accessible. So I get down on my hands and knees and I start talking to the dog. And tell her about the grieving process, and I stroke her and tell her what a good girl she is, and tell her something about SIDS, and with my warm voice and my attention to her, my touch, she relaxes and rolls on her back so I can get her tummy. And I said, people and animals need information about the grieving process. They need support, acknowledgement for their pain, and sometimes they need touch. And Bonnie said, well, look, it's working. She hasn't been like this since the baby died. Chris said, we haven't been giving her any of those things. It's been really rough. I said, yeah, but look at how she's accepting it from me, and I'm obviously a stranger. When you're able to give this to her, she'll really appreciate it. Well, without another word, he gets down, and he's stroking this big, long tail, and she gets down, she's stroking the head, and they're not looking at each other, but they're closer, and they're connecting with the dog, who is now happy. And I back off a bit, watch them doing this, and then I said, there's other things about grief I'd like to tell you, and one is that it's very, very common. Like over 80% of people grieving any kind of loss experience some level of guilt. And when it's something like this, you're getting close to 100, if not 100. And so could you let Lucky know that you don't blame her for the baby's death? You said she was sleeping in the room at the time. There might be a sense that she's done something wrong. Bonnie said, oh, Lucky, you would never have hurt the baby. We know that. We don't blame you. You're a good dog. If anybody's to blame, it's me. Because I'm the mom, and I should have known. Chris stops stroking Lucky's tail and looks with total bewilderment at his wife. I thought you weren't speaking to me because you blamed me. I didn't know you felt guilty. You have no reason to. She said, how could I even blame you? It's the mother that should have a sixth sense about this. He said, oh, my love. And he puts his arm out. She leans into him. Lucky gets up, goes into the kitchen. We can hear her chewing her squeaky toy. Happy, happy, happy. Now I sit and I watch for a while, but it gets boring fast, right? Oh, I love you, we should have, checked it out and all. So, I'm a fifth wheel here. So I said, look, I'll come back. And I did. I saw the pack probably 3-4 times over the next couple of weeks. Because it was a pack. Lucky always started with us. But when she saw they were connecting, she could move off. Now I see the healing power there is the quality we call love. They could not love themselves because they felt too guilty. They loved each other but couldn't show it because they were sure the other was going to blame them or was blaming them. But they could love their dog. And by loving their dog and being concerned about their dog, they got the courage to reach out for healing. They thought for the dog, but it then turned into healing and growth for them. And so I find that if I really want to be in their grieving, get a sense of what qualities people are living and support those and see how they are bringing healing. And make sure that people know that I'm not there to cure them, to take away what, and fix, but I'm to help them get in touch with the healing that's already present for them. I also have some other definitions down here in the handout, which you can just read as you wish. The grieving process for me is not a series of stages or phases or anything like that. It's a spider web. It's a spider web of meanings and implications. And when somebody is grieving, the implication that they are first in touch with is probably the one that's most important at that moment. Sometimes it's also the safest one to deal with. So somebody may say, when told that their partner has died in a car accident, that means we don't go to the movie tonight. And you think, what kind of relationship do you have? But what they're not able to say is, oh my God, I'm grieving the interpersonal implication of this loss. But that's what they're grieving. That bond, that connection is shattered. So I listen to the words and I listen to what implications and want to support support that. I worked with a group of counselors from Veterans Affairs who, some years ago, who were saying it's so hard. It's mostly widows we're working with, and we want to tell them their benefits. And we come in and we're trying to deal with the finances, and they're always trying to pull us away to memories or come and see his garden or whatever. And I say, okay, you're fighting implications here. Your implication is financial. That's what's most important. Theirs is something else. Maybe it's intrapersonal. Maybe it's interpersonal. Maybe it's a change in role or status or something that needs to be heard and honored. And I betcha if you give them a few minutes and honor the implication they're grieving, they will then very kindly move over to yours. And I was lucky enough to see this group 6 months later and asked, okay, how was it? And they said, works like a charm. Yeah, you've got to support the healing energy, and it's around a particular implication that the person's experiencing. The thing often I find, particularly with people with addiction, is there's a normal process that happens when we first hear about a loss. It's called emotional anesthetic. And we numb out, we space out, we may dissociate. And it's protective. If the full impact of a loss hits us all at once, it's emotional and physical overload. And so we have this real wonderful wisdom that just spaces us out. But people don't realize that's normal and they're scared of it. Or they don't even know it's there and immediately reach for medication or drugs or alcohol or something to try to do the same job. But it doesn't do the job as well. And I find that I do a lot of crisis intervention after trauma and sometimes on the scene. And if I'm working with someone and I see them space out, and I'll go, great, I'm glad that can happen. And usually their response is, oh, I'm so sorry, I don't know where I was. I say, you was not here, and that was because you needed to be somewhere else. And you have wisdom inside you that said, okay, I've had enough. Let's work with it. And sometimes that means working with it by saying, do you need more physical space? Do you need to be sitting further from me? Some of the adolescents I work with, I kick my secretary out of her office and I phone them in mine. And we talk for an hour and they share all sorts of things. But if I'm in the same room with them, they're sitting there like this. And they're not going to share. So that emotional anesthetic, supporting the need for distance or closeness, but also when I see it, saying, okay, this is telling us something. So we grieve for meanings and implications. Some may not come up for years down the road. And it's ridiculous to say to somebody early on in their grief, you know, when you get to be the same age as your parent who died, you may have some issues around that. Grieve it now, get it over with. You've got to wait till the time. But it's also very scary if you don't realize that the grieving goes in waves and that a new implication may bring a big wave up. You think, I've done it wrong. I thought I was dealing with this, and obviously I'm not. So to understand the grieving process, I think, is really empowering. Kendoka, I'm galloping because we don't have a lot of time, but slow me down if you need to or ask a question or make a comment. Kendoka talks about two styles of grief, the intuitive and the instrumental. And not all, but many men are instrumental. They find that their grieving goes better by not talking about it a lot, by not sharing their emotions, but by doing something productive, something meaningful. And while they're doing that, their thoughts and issues and feelings are coming up and being sorted through. If there's somebody else there who they can mention something to briefly, that's great. But the intuitive griever, who's often women, not always, does not find it helpful to be in the early days of their grief to be doing things because it takes them away from their issues and their processing. And so the classic scenario I get is the woman sitting in the living room, crying her eyes out, Kleenex all over the place, and feeling like she's moving through it. But he doesn't love me because he's in the basement building something. He's in the basement processing, thinking she's just wallowing in it. And two people who should be supporting each other are judging each other, thinking that they're not going to work it through. We've got to watch what our style is, because if we're intuitive, we may try to encourage clients to be intuitive too. If we're instrumental, trying to do that. So honoring our style. I find a lot of the people I work with, particularly people with addictions, just don't have a clarified style of grieving. They don't, they've kind of bumbled into it, as most people do, from looking at the people who were important in their lives as they're growing up. We learn to grieve in a certain way, and it's not working. On your handout, and do people at the back have a handout? No, you don't. Okay. Well, I'll give you the ones we have. Maybe a couple of people can share. Oh, and here's the trauma thing, too. There's only a couple more of those. Oh, good. Okay. Early on, people started asking me, how do I know when I'm psychologically ready to make a major change after experiencing a loss? And I didn't have the slightest idea. So I started watching, because I couldn't find anything in the literature. Sometimes the literature would say, don't do anything big for a year. I think, why a year? Well, it's a good number, right? A year. Or do it right away, get it over with. So I started to realize it had a lot to do with what's happening with somebody's energy. And by energy, I just mean that force that allows us to be and think and do. Real basic stuff. So some of us have large energy circles. Some of us have small ones. But if you look on the handout, the one on the left is often what someone experiences when they first hear of a loss or it first really impacts on them. That most of their energy, the black, is going into grieving or readjustment. They're eating, breathing, sleeping their loss. A small portion, the gray, is survival functions. So they can do some things, but they usually need a lot of help. Some people have even less of that and need to be put on respirators. They can't even breathe on their own. They're so much in shock. But as time goes on and we deal with different implications, and the thing with the spider web theory is that I can be walking along the financial one for a while, then move over to really working with the change in my role in my family, and then at some point find I'm walking the financial again. And it doesn't mean I've regressed or I didn't do it right. It's that obviously you don't just deal with one issue in our life and say, oh, that's gone now. But people get nervous. They say, I'm doing it wrong. Excuse me. The other thing, if somebody give me some water, that would be wonderful. Thanks, David. The other thing is that we obviously revisit the same emotions because we don't just do an emotion at one time. And yet many people have in their mind that when you're grieving, you go through the anger. And then you go through depression. And that's the way you do it. And then here I'm back to anger. I said, no, you're not back to anger. You're ahead to anger. So what are you angry about now? What's the issue you're dealing with now? At some point, as we move through, we get to the second circle where all the energy we need for survival is intact. But we've still got a lot of energy going into grieving and adjustment. And this is where I find more people come for counseling, thank you, than any other place. Because they say, I feel worse now than I did a few weeks or months ago. This is also where I think a number of people really start to abuse substances because they start to feel some despair. Isn't it ever going to end? It just seems to be getting worse. And it's actually not worse. And when I draw the circles and help them see where they are, they say, it looks like I'm moving forward. Why do I feel worse now than I did a month ago? I said, because you kept having that emotional anesthetic then. You don't need it now. Your system is able to, it has the resources, it has enough survival energy to be able to deal with things. And so this is positive. You feel worse because you're able to monitor yourself. You can think of your issues more clearly. Oh, okay. So I am moving forward. I thought I was regressing. I was starting to feel some shame. Yes, sure.
I'm sorry. I do research in bereavement. I was surprised, not surprised, but what strikes me is many people say that over the years they feel like grief is a roller coaster, so it comes
Yes.
and then you hit the deepest sadness, and then they hit the wonderful feeling of, strength and
Sure. It's a roller, yeah, it goes in waves, is what I say, yeah. Well, I think it's because it's waves of implications. You know, I mean, an implication will come a year from now that couldn't be dealt with now, or some new, you know, and then you have to put a lot of energy into that. And there's a lot of emotion around it, a lot of issues around it. And so, yeah, but does that fit with your research? It's an explanation. Oh, good. Okay, I'm glad. Yeah, yeah. And you see, if people realize that, then it empowers them. You know, and then they don't say, oh, well, okay, I'm over that one, and nothing will ever bring it up again. I've just been arbitrary about saying, you know, half of our energy is needed for survival. For some people, particularly people with a chronic illness or people who care for someone with special needs, it may be 3/4 of their energy always has to go to survival. And then we need to be real creative at how to help them bring in some life enhancement. And in A Path Through Loss, I talk about a strategy to do that. But at some point, some life enhancement comes in. And many people say it happens almost overnight. They wake up one morning feeling some lightness. I had actually one client come in to me, and she was really in rough shape, but she'd made quite a bit of progress. And one day said, and I knew there was life enhancement, she says, this was 24, nearly 24 years ago, she said, you're pregnant. I said, yeah, I'm 8.5 months pregnant. Ha! She said, you just start showing? I said, no. She says, did I know you were pregnant? I said, remember the first session where I told you and when I'd be stopping my oh yeah, I kind of, how come I said, because that's life enhancement stuff. And you weren't ready for that. Many clients will come in and say, you got new lighting? Yeah, it's not as dark in here? Life enhancement. People can wake up feeling a sense of lightness. They can start adding new things and want to, not to deal with the pain, but just because they've got some energy freed up. Or they can find that what they're already doing for survival is enhanced. So they play with menus rather than just cook and eat because they know they need to. This is where I think, and I'd love somebody to do research on it, because I've seen it a lot, is where the rebound effect happens after a relationship breakup. So Joe's been telling me for months, hate him, not going to have anything to do with him, never get into another relationship. And then he feels a little bit of life enhancement. And he feels some lightness, and the birds are singing, and he looks out the window, and instead of looking out the window and saying, oh, bah, humbug, it's beautiful, but there's, pain in the world, he looks out and he just says, wow, isn't it beautiful? Takes the dog for a walk, meets someone walking their dog, they smile at each other, and he feels something. And he says, true love. I haven't been feeling anything for months. They get into a relationship which isn't based on anything healthy, and the first time he has to commit or really work on it, he doesn't have the energy for it. And he's, I'm out of here. Burned again. You probably know people who've done that. They take the little bit of energy in life enhancement and they just use it up. And then they feel more depressed, more discouraged. There was glimmer. And as time goes on, people may get to a place that kind of looks like the fourth one. Although again, people with ongoing issues, and I can see, you're in recovery, you're still putting a lot of energy into dealing with that. It may be 3/4 of your energy needs to go into the survival stuff. But that you still always have a little bit of energy going for grief. And that's what, again, gets larger at those times that are significant in some way, or issues that come up. But when people say to me, I want it to be that nothing will trigger this loss off again, I'll say, well, die. I mean, nothing short of that is going to do it, because you're a human being. And in fact, it can be bittersweet to have that energy suddenly moving more into memories, into certain feelings. You may see your daughter walking down the aisle and really wish that her natural dad was there, And that can bring you closer in that memory. And and if you know that beforehand, maybe she can be wearing something that represents him. Like you can do something to honor that surge of grief and not see it as something negative. So when I'm trying to help people make decisions, if they're changing jobs, if they're changing treatment programs, if they're changing relationships, schooling, whatever it is, it takes a lot of energy, not just physical, but mental and emotional and spiritual energy to make a transition. And as we know from the research that Van Gennep did on ritual, is that when we're moving from one state to another, one status to another, we move into a liminal place for a bit, a place of vacuum, a place that we don't know how to be in. We're no longer totally one thing, and we're not yet the new, and that's scary. We could lose ourselves. We could lose who we are. And so we need something to support us at that point. And it takes a lot of energy, and we hopefully have a community that supports. But if I try to do that in the first two circles, my energy is going to be pulled from grieving, and I'm not going to heal well, or it's going to be pulled from survival, and I find I won't be able to do what I had been, and that really affects my self-esteem and self-image. If I wait till I have, in the third one, a bit of life enhancement energy, I've just been feeling a bit of lightness, and all of a sudden it's gone. And boy, am I discouraged. I'm going to do anything I can to try to get that back. And hey, that drink could do it. It's best to wait sometime between the third and fourth circle. For some people, that means a few days, for some weeks, for some months, and for some years. But I find that what people are more concerned about is getting stuck. So if they have a sense of movement, they have a sense that, yeah, I'm going back and forth, but I'm dealing with things, that's empowering. And then the person doesn't have as difficult a time, that it's taking a while. The other thing is, if they realize, look, I need to be doing this soon, then how do I intentionally give up or delegate some of my survival functions? I found that's very empowering for people who would say, okay, I'm going to change some of my roles to free up some energy so I can do this. And then they're working with it. Any comments or questions? Does that fit in your working with people? Yeah? Okay. Okay. There's been some research on this. I want some more done, but the research so far says, yeah, it's working. Okay. Now, any emotion that just comes up naturally as part of the grieving process is there to help us, I believe, to give us information about an implication or something that needs to be done. So if I feel anger and I give that a voice, I don't just go beat up on somebody, but I give it a voice, I may realize I need an advocate, or I'm being thwarted in some of my needs, and I need to confront someone or to work it through. But if I say, oh, I don't do anger, I'm a good Christian or Buddhist or whatever, and I repress it, obviously it doesn't go away, but it takes a lot of energy to push it down. If on the other hand I say, boy, this anger helps, I get my needs met, I'm going to do more of it. Then I put a lot of energy into it and I magnify it. Well, if I do that, either way it takes a lot of energy. I call it expensive emotions. It's an attempt to try to deal with the situation, but it's not just allowing that natural emotion to emerge. It's trying to control it. Either repressing it, it turns into bitterness, resentment. And you know someone who's bitter, they will not admit to having an issue, but they're spewing out this poison all over the place. And if they magnify it, it turns into vengeance, hate, real, us and them. So it's expensive in terms of the amount of energy a person puts in, which takes them away from healing. It's expensive in that it gives them a really negative orientation to life. It's expensive in many ways. I see sadness often becoming expensive and turning into despair, and a longing for healing turning into envy and jealousy at people who seem to have a better life or an easier time. Feeling blocked often turns to helplessness. So what I try to do is not to take away those expensive emotions again, but to to help people learn how to do the original ones better. And then as they do that, they start to realize, hey, it's way less expensive, it's less pricey. And I may do some of that by asking them to remember times where they were angry, could be angry, and then bring that into the present. I want to do we don't have a flip chart. That's okay. I will. Can you get one quickly? If you can, that would be great. And a pen? Okay, then we won't do that right now. Any questions about that? Are we doing time? When am I supposed to stop? 1:15. Okay. I'm going to put the trauma desensitization technique off a little bit to the end because I'm hoping to have you hear some of it. When somebody comes to me feeling guilty, they say, oh, I feel really guilty. Oh, I've got this addiction, or I've done this bad thing, or my usual response to them is good, which gets their attention because they're expecting me to say what? Oh, you don't need to feel guilty, you're just human. And they know how that one's going to unfold, and we won't get anywhere with it. So I say good, and they sometimes get mad, and sometimes get startled, and they say, well, what do you mean good? You want me to feel guilty? I say, no. But the thing is, feeling guilty means that you've got a conscience. And I like working with people who have a conscience. I rather prefer that to the alternative. The thing is, though, that I believe guilt is a motivator. It invites us to look at a situation to see what needs to be done to change our attitudes and behavior in order to live safer, more healthily, freer, more empowered. But we don't do guilt well. We don't say, okay, what are you trying to tell me, guilt? We just say, oh, I've done wrong, and we start punishing ourselves. So that's like, not even giving yourself a trial. So what I'm going to invite you to do is to work with me to move deeper into the guilt to get a sense of what we need to learn from it. And I have a 3-part process for working with guilt. And it's hopefully, yes, I wrote it down here. So I had a fellow who came, and I do some prison work in Victoria, and he was just about to get out. And he had finally done some jail time for, I think it was about the 15th accident, MVA he had while driving impaired. And the last time he had hit a little girl, she was not killed, but severely injured, lots of orthopedic injuries, had to have a lot of blood transfusion to save her life. And he said, I've done a lot of programs in here. I've been sober. I'm going to continue. I've got a good connection with AA. I've got a church connection. But I still feel guilty. And so he had already worked on this model somewhat with his chaplain because I'd done a workshop some months before in the prison. And so they had done the first step. They had spent a number of sessions looking at the guilt and what the guilt was saying. And then they looked at this, and for many people, that's all that's needed. By just really opening up, moving into it, they start to balance themselves, or they start to realize what needs to be done and go and do that. He looked at the second step, which is re-education or education. What do you need in order to live in a healthier, better way? He said, well, I'm AA, and I've done assertiveness programs, and I've done communication skills. I've done a number of things which I know are going to help me with that. I've changed a lot of attitudes, so he told me what he'd changed. I said, okay, so is guilt still there? He says, yeah, it's less, but I'm going to walk out of here with a kick me sign on my back. I know that. I said, okay, the third step is reconciliation. He said, oh, well, I have done that for years. I said, what? And then he starts telling me how he's punished himself. I said, no. Punishment is a restriction. Reconciliation is using some of your qualities, some of your resources, some of your talents, gifts to give to the world, but also give to yourself, because you can't do one without the other. Have you been doing that? He says, well, I've done a little bit you know, I've been helping out. I've mentored some of the new guys that came in, but not specifically about this. And I said, yeah, that's the thing. It needs to be intentional, that you're doing this reconciliation because of your offense. Now, some people talk to me, and it's just irrational. They have not offended, and yet in their mind they have. And I don't fight with them about that. If they believe they have done something wrong, we can do this process because it's freeing. But he had done something wrong. And so with his chaplain's help, he contacted the family through the police first and then their lawyer and said, I don't know if you want any contact with me or not, but I'm trying to think of something to do to give back, to do reconciliation because of what has happened. And if you have any input in that, I would really appreciate it. And what they said is, well, we'd like to tell you our story. We want you to hear what it was like for us. And then maybe we can come up with something else. So they had a meeting, and as a restorative justice or transformative justice meeting, and he had support people there, and so did they. And Amy told her story, how scary it was. She says, the light was green, and it said walk, and I'd looked both ways, and I was doing everything I was supposed to, and then all of a sudden I saw this car, and it hurt so much. And the parents told how scary it was for them, thinking she was going to die, and that she needed blood transfusions. And so he said, of course, that was the worst. That was worse than any jail time, hearing the story. He heard, he listened, he used his communication skills. And then when they finished, he said, what else can I do? Is there something else you want me to do? They talked about it, and Amy decided that he could give blood because she'd needed a lot of blood, and she, moving a bit out of the restorative justice mode, said to him, do you like needles? He says, no, actually, I try to stay away from needles. She says, well, good then, you give blood. Then he says, I'm going to give blood for the rest of my life in your name, Amy. The chaplain was wise enough to say, whoops, that reconciliation is going to turn into punishment pretty fast if it becomes a should like that. What's a symbolic time? Well, they worked on that together and decided 9 months. 10 times he would give blood because she was 10 years old, and she says, and double digits are important. If you know kids who have come to that, yes, it's very important to suddenly be 10. So once he was released from prison, he gave blood 10 times, and then he wrote a letter, sent it to the lawyer, and they gave it to the family, and he said, Amy, I have done what I said I would do for you. My guilt feels much less. I thank you for that. Again, I'm so sorry for what I've done for you. But I'm going to keep giving blood, and I'm not going to give it for you anymore. I'm going to give it because I have a new community. I've finally met some people who don't drink all the time. And in fact, one of the guys that frequently comes when I do, well, he said he might get me a job, and that's really hard to do when you're out of prison. He said, I've got a new lifestyle now, and this is part of it. And so the right reconciliation does that. It uses a gift that somebody has, but it also reconnects them with their community and using it in a way that is going to support them and sustain them. And doing it for that reason, like if we had just said to him, go out and start to make some new, social networks, he wouldn't have done that. But again, he's doing it for her. He's not thinking he's getting anything out of it himself, and yet we know he is. Any comments or questions about that? I know you probably have your own way of working with guilt, but this is just... Okay. If somebody's feeling guilty, though, when we do that first step, if they are not able to forgive themselves, they are not going to be able to forgive somebody else. So I do the guilt work first if somebody is saying, they've got forgiveness issues. But I just want to do another quick exercise with you, and thank you for bringing this. So again, if you close your eyes, and it's mainly so that people don't think they're being looked at, it'd be nice. And I'd like you to remember a time, it could be when you were a child, it could be more recent, when you did something wrong, intentional or unintentional, doesn't matter. You might have took some cookies your mom had baked for the bake sale, or something much stronger than that, doesn't matter. But you did something wrong, and you were forgiven. And you actually let that forgiveness in. You felt it. And then what I'm hoping you'll do as you're sitting with your eyes closed is just call out some words or phrases that speak of being forgiven. What was it like to be forgiven? And you do it loud so I can hear it from the back. Relief? Okay. Anybody else? Lightness. Rest. Freedom. Grace. Oh, praise? Thank you. And somebody else said something I didn't hear. Love. Peace. Sorry? Anybody else? Gratitude. Okay. Now shift over, still with your eyes closed. And remember a time where somebody wronged you. Could be a client, could be a family member, a friend, someone you didn't really know. And you truly felt forgiveness. Not because you're a good person or because your faith tradition says you should, not out of duty, but you truly experienced forgiveness towards them. You may or may not have told them. It doesn't matter. Just that you experienced it. And when you're ready, just give me some words, please. Relief. Release. Calm. Okay. Calm. Enjoyment. Somebody else said something? Peace. What's it like to feel forgiveness? Reconnection. Compassion, somebody said. Freedom. Okay, so now slowly open your eyes when you're ready. And imagine somebody came into this room now and asked what we were doing. And we told them that one side is the experience of forgiving, and the other is the experience of being forgiven. What would they say? Yeah, they're the same. Which is which? And I've found that doing an exercise like that with someone who is wanting to forgive, but is scared, they think they're going to give up power. They think they're going to let someone else off the hook. They think they're going to diminish themselves in some way or make themselves more vulnerable. I say, no, it just means getting back to the original emotions that can help you, like anger, and setting limits and protecting yourself, and you're freer to do that. Because the expensive emotions of vengeance, of resentment, of hate, keep you bound. And true forgiveness is as beneficial for the forgiver as the one being forgiven. And in fact, might even help the forgiver more. So often just doing something like that, it will help someone be committed to working on that area. A lot of the people I work with are holding on to grudges, resentments, or are actively in a vengeful mode because of abuse that's happened in their past or whatever. Yes?
Is it not possible that the same principle applies to grief if you can articulate them as well as the guilt here?
Yeah.
You can articulate them, it helps to get it out of you.
Yeah, that's what I believe. Yeah. And yet, keeping in mind the instrumental intuitive styles, some people who are in instrumental style, it doesn't help to tell me all of that stuff. You know, they may do that in other ways, maybe through journaling or discussing with themselves or whatever.
Are you familiar with the program Reshare?
Yes.
I went through it twice.
Yeah.
And to me, just because you come like a little group of similar problems.
Yeah.
And,
To support each other.
It just seems like you open up.
Yeah.
You're sharing things
Yeah.
that most of us in the broader society, whether the church or wherever, like,
Yeah.
people, how are you?
Right. Yeah.
You know, so
Right.
artificial.
Yeah.
It means well, but it's so artificial.
Sure. So to move past that. So do you find that just life helps you to articulate your issues?
Well, I think so.
Yeah, okay. So you're an intuitive griever. And so that's your style, and that is helpful for you. That's great.
Okay, I'm going to find out something.
Yeah. So that's your style, and so you got to honor that style. Yeah. And yet someone else who isn't, it doesn't help in that way. But there's other ways to do it. Yeah.
And what's been your experience with someone that is experiencing tremendous, or what in their intense guilt, and they are in a situation where the other person is not going to forgive them?
Right. Oh, yeah.
Because there's that. What's been your
Yeah, that
experience
happens a lot. Okay.
with
The wonderful thing about this, the question was, what happens when somebody wants to, ask for forgiveness and the other person will not forgive them? That happens frequently. You don't need it. You don't need it. Because if you go through the process and you do something in that person's name, even though they're rejecting it, so it can't be done, directly to them, but it still has that energy shift.
So you really better come into intentionality.
Exactly.
Back then
Yep.
to,
Yep.
it's okay if the other person does not forgive
That's
you,
right.
but by your intention and your behavior,
Yeah.
and to carry on. If the game is authentic.
Sure, because what you're doing in that working through guilt process is you're owning your responsibility, but you're also giving them theirs. And if they're choosing not to forgive you, you can feel sad about that. But if you're still got the expensive emotions, you're bound to them and you can't shift.
So there would still need to be work done around the first step. If
Yeah.
you wouldn't let go.
Yeah, for sure. Lots of work around that, for sure. Yeah. Taking your responsibility, but no more than your responsibility. Yeah. They have their life. Set them free. Yeah. Did you, Neil?
Could you translate that into a situation where someone is feeling guilty about causing another person's death?
Right.
No, the person's gone.
Yes. And okay, actually one of the guys that I worked with in the prison, that scenario, we'd both been drinking. I don't know what I did, but when I came to myself, she's lying dead, and I know I strangled her. He'd done a lot of time for that. And, no way I can talk to her. And we could do some Gestalt stuff and whatever around it. But when we took him through this, he got to the reconciliation part, and he said, I have no clues what to do. And I said, well, tell me more about her again, what her interests were, what her passions were. And he says, well, her mom had breast cancer and died of it. And she had just started doing some volunteer work for the Cancer Society. And then light bulb went on, and he says, okay, if she knows, if she's in heaven somewhere looking down on me, she would be real pleased that I would do something for the Cancer Society. So he contacted them to see what can I do in prison, and they had him do some writing, stuff for them, and then he helped when he was out again. So you can do a specific penance in that way. Does that answer what you were?
Yes, it does. It does. May I be?
Sure, go for it.
My mother died in a car accident.
Mhm.
Drinking driving. When I was 16 years old. And I believe that I caused that.
Okay.
Because what I believed was that she wanted me to give her a ride to work, and I did.
Ah, right. Yes, and you let her down, and because you did that. Yes. Yeah. Yeah. Because they wanted to just say, oh, no, you didn't.
Yeah.
Right. Yeah.
So I
Perfect.
And
Right.
I got constantly.
Yeah.
But all the time, that was having an effect on relationships.
Oh, yeah.
Everything else.
It restricts everything.
And I can imagine that lots of people walking around with that kind of guilt for something.
Absolutely.
And it doesn't occur to them that it's just existential. It's just that.
Right, right, right. Because they haven't gone into it enough. And that's why that first part, because if he couldn't hear, he said he carried this guilt thinking he'd killed his mother for 35 years. And it wasn't until he started to work on it and really open it up, like doing that first step. What is it saying? What do you know, I keep saying, what else do you feel guilty about? What else do you feel, how is it affecting you? How is it affecting you spiritually, mentally, emotionally, physically? By getting into it, you start to see some truth and reality, and you realize, I didn't, or you realize, I did, but I can now do something to, make sure something like that doesn't happen again. So that's very powerful, that. But people do walk around and they feel this guilt come up. What do? I better drink something to stop that.
But it was just that there's nothing to do because that's what it is. So,
Yeah.
like when my first marriage ended and we were both getting some counseling from the same
Right.
person to pick up the pieces,
Yeah.
I got a tremendous amount out of it.
Yeah.
And when I asked her how it was going for her, and she said, well, I stopped. It's just trying to make me feel not guilty, and I am guilty, so what's the point?
Yeah, and you see, I don't try to make people feel not guilty. That's the whole thing about this. I say, you feel guilty, you believe you're guilty, fine. I'm not going to fight you with that. We go, but do you want to be safer in this world? One woman came to me and she says, I killed my son. I didn't understand that 3-year-olds could climb fences. We just moved into this house. He climbed over and fell into the Thompson River, and we didn't find his body for 3 days. That was 30 years ago, she says, and I punished myself every day. And I asked her, how do you punish yourself? And she told me, and I said, it sounds like you're also punishing your family. How do they feel about this? Oh, they hate that I do this and that. And I said, okay, so you can choose to do something for yourself, but you are also got to realize that you are hurting your family. You're restricting them. They're being punished for your offense. Oh, I don't want to do that, she said. I said, okay, well, if you're willing and you want to work through this, then you can get to a place of reconciliation, and you can do that as much as you want, because that just enhances. And she then was with the program. So, yeah. Oh, shoot. We can't. We don't have time because people need to go. And I want to honor that. My trauma desensitization model, you have a handout about it, which talks about it. I have it also with a real client on a set of CDs, and there's information out there with my books at the back. But basically, the trauma desensitization model is the way I deal with intrusive thoughts and other things around post-traumatic stress disorder. And it's based on the well-known behavioral principle that you cannot maintain anxiety if you're concentrating. If you're focusing, your mind can't flit around, and the anxiety doesn't occur. And just from what you were just saying about actually going into it. So I ask people to tell me about their traumatic event, and I ask them a lot of questions to get them to focus. We did this actually in the 3-hour workshop a couple of days ago with someone who was still feeling some trauma about working with a particular client's incident. And she kept wanting to speed up and get past it, but then that develops a phobic response. So I kept slowing her down. Okay, and what did you notice then? And which hand did you reach out with? And what did you? And as she does that, you can actually see the person who starts off like this. I don't want to go near this thing. Have to think. I'm asking some silly questions. Some questions they haven't considered. Things like you say, I didn't realize that. And when I asked this woman who had been assaulted. She had the cash from her fast food outlet. She was the manager. And when I said to her, okay, you reached for the car door and then you heard the swish of the baseball bat, although you didn't know that's what it was at first. Which hand did you reach out with? She said, which hand? I said, yeah, which hand? And you could just see And as soon as that shift happens, that instead of her going, the trauma, to the trauma, she's got some power. And you can see the anxiety decrease. My right hand, because I kind of turned to my left, and I just, out of the corner of my eye, saw that baseball bat. And so I just keep slowing the person down, slowing the person down. You don't do this in the first month or so after trauma. They need to vent. You do it when you know that they have post-traumatic stress disorder. I've done it with hundreds and hundreds of people. I usually do it at conferences to demonstrate it. We just don't have time. It's on the CD. But I know why it works. I use it instead of EMDR or anything like that because I think, well, I know why it works, and it's working, and you know, it's very simple, but we need to, there's a number of things in the handout about you need to be very present. You need to not be thinking in your own mind what's going on, because then you can lose it. And as soon as the the anxiety starts to escalate, you've got to just go back slightly, but then stay there and ask a lot of questions. And it's just remarkable how that shifts. And so I've done that. I work a lot with people with traumatic brain injury, who also have PTSD, who also often have an addiction issue, or even if they don't, are never allowed to drink again. And that suddenly is a big issue. And it works really well. It especially works well with perseveration. So if you work with people with traumatic brain injury who perseverate on the negative stuff, by doing something like this, it can shift over and they'll perseverate on positive, which helps a lot. Anyway, I realize we need to stop, but thank you very much. I'll be around for a while, although I have to go early because I hear there's a 3-hour wait for the ferry to get back to Victoria. My books are out there and the CD information. Thank you, thank you, thank you.